Hello everyone, in this lecture we are going to study the Norma Frontalis, that is the frontal view of the skull. When you look the skull from the front side, what are the structures which we see? We will study about them in detail. So in Norma Frontalis, the structure, the skull looks roughly oval in outline. When you make the outline of this structure, it looks like this. Can you see? And this is almost oval in shape and it is wider above. Here it is wider and narrower in this part. Okay, and after this we will see how the bones are arranged and what are different bones which are present in this view. See, we will study the name of bone from the above. The first bone from the above is the frontal bone. This is the frontal bone, and then this is zygomatic bone. Zygomatic bone. We'll study about these bones in detail, but just see the outline and the types of the skull or types of the bones which we see in the skull in this view. Okay, here on both the side we have maxilla. This is left maxilla, this is mandible. Okay, this is nasal bone. These were the some of the major bones which we see. Okay, when you look at the frontal bone, it is seen that it is smooth and convex on the upper side, but on lower side it is bit irregular. Can you see how the irregularity of the frontal bone? And this is the part of the frontal bone only which is forming the roof of this orbit. So on the lower side, this frontal bone is interruption is there, and which causes the irregularity. What are those interruptions? First is the orbit. This is the orbital opening which is causing the interruptions, and there is a irregularity due to this. Then second is the nasal part. Which is causing the irregularity. That's why there is irregularity on the lower side of the frontal bone. Before going in much detail about the frontal bone, we will see the structures and we will divide the whole view, that is frontal view, into different regions. Just note down all the regions which we are going to study in this view, because it will be easier for us to study region wise. First is the frontal region of the skull in Norma Frontalis. Okay, second is the orbital opening. Okay, C is the anterior. Piriform. What do you mean by piriform? Piriform means pear-shaped. Shape, bony aperture of the nose. And D is the lower part of the face. So we will study this structure, this view, whole view, region wise. Then it will be easier for us to understand. The first view or the first region which we will study is the frontal region. Okay, and when you see the frontal region, you see the structure which is very prominent in the frontal region is the superciliary arch. The structure is known as superciliary arch, which is above the orbital opening. This structure you can see. Let me highlight this structure. Can you see this structure? This is the superciliary arch. Okay, and this you can see it is curved as well as rounded. What does the word means rounded? When you touch the skull like this, when you touch your forehead region like this, and you can see this part, it will be rounded. When you touch this, it will be rounded because you can't see any sharp bend there. Okay, so this is rounded like this. Can you see the rounds? This is the round look. Okay, and it is curved. Since it is like this, it is curved. Okay, it is rounded as well as it is curved. Okay, am I clear to you? If you have any doubt, you can write in the comment section also. I will make the points clear. Now the structure which is present in the center here. But let me explain you one more thing. This superciliary arch overlies the frontal sinus. Now what does the frontal sinus mean? Sinus means space. So the space which is present behind this structure is known as frontal sinus, and superciliary arch overlies this. Now let me show you how the structure will look like. See, this is just a frontal bone. This diagram, this image has been taken from Gray's Anatomy. Okay, can you see the structure? This is the superciliary arch part. Okay, when you see the superciliary arch, this will be the superciliary arch, which is rounded part. And when you see the underside, you will see this structure like this. Can you see this structure? See what we did, we saw the lateral portion and we cut the skull. We see there is a space which is present here. This is which part? This is the part which is known as, can you see the rounded part? Yes, this is superciliary part. This is superciliary part. Okay, superciliary arch part. And can you see this part is above this? It overlies the space. This is frontal sinus. Can you see the space? This is the space in the frontal bone. That's why this space is known as frontal sinus. This is frontal sinus. Am I clear? Here in the center, the glabella. This part is known as glabella. Okay. This part is known as glabella. Glabella is the median elevation. This is glabella. Glabella. And what is glabella? It is the median elevation which is connecting the two superciliary arch. Both the side we have superciliary arch, and this is the medial part which is connecting this superciliary arch as well as this superciliary arch. Am I clear? And below this glabella, the skull recedes to frontonasal suture at the root of the nose. See here, you can see the frontonasal suture. Let me show you. This is the frontal bone, F frontal bone. This is the nasal bone. This is the nasal bone on both the side, and we have suture here. And this is known as frontonasal suture, which is just below the point known as glabella. Okay, am I clear? So here one more suture we can see. This is metopic suture, which is not very clear in all the individual because it fuses after 1 year of the age. Okay, then we have the point known as nasion. It is the median point at the root of the nose. This is the root of the nose. Am I clear? This is the root of the nose. And nasion is the median point at the root of nose, where internasal suture. Can you see the internasal suture here? This is internasal suture, and frontonasal suture meets. So this point, let me mark it with red. This point is known as nasion, and it is present here. You can feel on your forehead there is a tuber or eminence here in this part, or both the side. You can see there is a little eminence is there. Low rounded part is seen. Felt cannot be seen. It is felt. That is known as frontal tuber or frontal eminence. It is the elevation which is above the superciliary arch. Here you have superciliary arch, and here in this part you have the tuber part. When you will touch on both the side of your forehead, you can feel that eminence. It is the more prominent in female and children. What? This frontal eminence is more prominent. You can feel it properly in case of female and children, but in case of male it is not that prominent. Okay, am I clear? So we read about the frontal region and we studied about superciliary arch, the glabella, the nasion, the frontal tuber or eminence. Am I clear? Now we studied about this. After this we will study about orbital opening. What is orbital opening and how, which bones are surrounding the orbital opening? Okay, can you see on both the side we have the orbital opening. This is the orbital opening which is present on both the sides. See, each orbital opening is quadrangular in shape. Quadrangular means how many? Quad means 4. 4 angles are present. 1, 2, 3 and 4. 4 angles are present. That's why it's known as quadrangular in shape, and it is bounded by 4 margins. One, let me mark it with red. 1, 2, 3 and 4. We have 4 margins, and we will study about each and every margin. The margin, that is supraorbital margin. From the name itself you can get the image of what that does that structure mean. This is supra. Supra means above. Above what? Orbital. Orbit. So it is known as supraorbital margin. That is this margin. Can you see? Let me mark it with another pen, another color, so that it will give you a clear structure. This is supraorbital margin, and it is formed by frontal bone. This structure, this margin is formed by the frontal bone. Can you see the structure? The frontal bone is present here. The frontal, it is the extension of This is the frontal bone which is forming the upper margin or known as supraorbital margin of this orbit. Am I clear? And at the junction of its lateral 2/3 and its medial 1/3, see what I'm telling, lateral 2/3 and medial 1/3, we will, this is lateral 2/3, lateral 2/3, and here it is medial 1/3. Here you can see a notch. Here we have a notch is present. Can you see the notch here? This is the notch part. Medial 1/3 part and lateral 2/3 part. At the junction of this part and this part, here we have a notch, and that notch is known as supraorbital notch. And there is a foramen. That foramen is known as supraorbital foramen. Am I clear? Here we have a notch. Can you see the notch? This is notch is known as supraorbital notch, and supraorbital notch is known as, here we have a foramen called supraorbital foramen. We will study about those foramen in detail later. First we are getting a proper idea about those structure. Okay, we studied about the supraorbital margin. Now we will study about the infraorbital margin. It formed by the, can you see the infraorbital margin here? This is infraorbital margin, and when you will see this structure, it is formed by two bones. First is the zygomatic bone. Here on lateral side, it is formed by the zygomatic bone. This is the zygomatic bone. Okay, and the medial part is formed by the maxilla. So infraorbital margin is formed by the zygomatic bone laterally. See the lateral side. This is the lateral side. See, for the first year student who have started studying now, the mark or the point which is close to midline is known as median, and which is away from midline is known as lateral. So lateral part is formed by the zygomatic bone, and the medial part is formed by, this is the medial part which is closer to this midline, and this is formed by maxilla. Am I clear? So supraorbital margin is formed by the frontal bone. Infraorbital margin of this orbit is formed by two bones, that is laterally by the zygomatic bone and medially by the maxilla. Am I clear? And we will see the medial orbital margin. What is median orbital margin? We study about two margin. This was superior margin. Then we studied about the inferior margin. Now we will study about the median margins. Can you see this median margin? This is the median margin, because we have four margins will be there. But median margin is little ill-defined. Okay, there is no single bone which is forming this. Yes, this median margin is formed by this single bone, because we have a collection of bones there. It is formed by the frontal bone ever. Can you see this part? It is, this margin is formed by the frontal part. This is the frontal part. Till here it is formed by the frontal part. Okay, then it is also formed by the lacrimal part. See, it is formed by the frontal bone above and by the lacrimal crest of frontal process of maxillary bone or maxilla. See here, maxilla is also forming this structure. Can you see? And this part which is forming the margin, which is forming the medial margin, this is known as the lacrimal crest. That is, here we have lacrimal bone. This is known as lacrimal bone. So part of the maxilla which is closer to lacrimal bone is known as lacrimal crest of the maxilla. Am I clear? And since this process, this is the process. This process means extension. This process is towards frontal bone. This is the frontal bone. So this process is known as the frontal process of maxilla. Am I clear? So this median margin is formed by the two bones. One is the frontal bone and the second is the formed by the lacrimal crest of frontal process of maxilla. Lacrimal crest, why it is called lacrimal crest? Because it is present beside the lacrimal bone. This is the lacrimal bone. Let me show you the lacrimal bone. This is the lacrimal bone, and this is the part of maxilla which is beside the lacrimal bone. So this part is known as lacrimal crest. This part is known as lacrimal crest, and this process, extension of maxilla towards the frontal bone, is known as the frontal process of maxilla. Okay, now we have this lateral margin. Okay, so lateral margin is formed mostly by the frontal process of zygomatic bone. Can you see this zygomatic bone? And here we have the frontal process. Can you see the process? This is the extension of the zygomatic bone. See the frontal process of zygomatic bone. And this frontal process of zygomatic bone forms more part of this orbital, that is lateral orbital margin. Okay, but it is completed above by the this process. Which process? Zygomatic process of the frontal bone. This is the zygomatic process of frontal bone, and this is frontal process of zygomatic bone. Am I clear? So we have two processes, one this process and this process. This is known as, why this known as zygomatic process? Because this is the extension towards which bone? Zygomatic bone. And here the extension is towards which bone? The frontal bone. This extension is towards frontal bone. So that's why it is known as frontal process of zygomatic bone. Am I clear? So you got all the four margins. Let me revise it once. Okay. So the supraorbital margin, which is formed by the frontal bone, and at the junction of lateral 2/3 and medial 1/3, lateral 2/3 and medial 1/3, there is a notch called supraorbital notch, and there is a foramen which is known as supraorbital foramen. Okay, we have infraorbital margin, which is formed on lateral side by the zygomatic bone and medial side by maxilla. While medial orbital margin is ill-defined, it is formed by the frontal bone, here this small part of frontal bone, okay, and the lacrimal crest of the frontal process of which bone? Maxilla. So two bone forms, one is the frontal bone and second in the maxilla, and in maxilla also there is a part known as lacrimal crest of which process? Frontal process of which bone? Maxilla. Am I clear? So this is the maxilla. So here, and the lateral margin is formed by the two process, that is two extension. One is the extension of frontal bone, that is known as zygomatic extension. One is the extension of zygomatic bone, and that is known as frontal extension. So here we can complete the orbital region, orbital opening region. Okay. Now we will study about the piriform aperture of the nose, anterior bony aperture of the nose. Can you see here? This is the anterior bony aperture of the nose, and here we have a small notch present here. Okay, this is known as anterior aperture, which is pear-shaped, which is wider below. See, it is wider below but narrow above. It is wider below but narrower above. Am I clear? And here also we have some borders. Okay, here also we have some borders, and above by the lower, it is, these are boundaries. Here we can see the boundaries. On the above side we have the boundaries known as, this boundary is surrounded by which bone? The nasal bones. We have two nasal bones. These are the nasal bones which is surrounding or which is bordering this aperture from above. Okay, and from below by the nasal notch of body of maxilla. What does that mean? This is known as the nasal notch. And this part of maxilla, see, this part of maxilla is known as nasal notch of maxilla, and it is surrounding from the aperture from below. This is the nasal notch of the maxilla. What does that notch means? Notch means there is a slight depression. Now we will study about different articulations, that is features of this aperture. Okay, this we will study about whole this bony part. Anteriorly, with opposite bone at internasal suture, there is an articulation. What does that articulation means? Articulations means where two bones join. Where two bones join. Okay, here you can see this part. There is a joining of which bone? The opposite bone, that is nasal bone. Nasal bones joins to form anterior nasal, internasal suture, form internasal suture. Am I clear? So here you have the internasal suture. While posteriorly there is articulation with the frontal process of maxilla, which we cannot see in this diagram, but here anteriorly in this aperture we have this. This is on the anterior side, we have this internasal suture, but on the back side, that is when you remove the nasal bones, when you remove the nasal bone, you can see how the nasal bones articulates with the posteriorly with the maxilla. Here, can you see? Anteriorly, this is the nasal bone. Can you see here? Yes, this is the nasal bone. And anterior part, this is the anterior part. And here we have the internasal suture. Internasal suture. While the posterior part, that is this part, we have articulates with maxilla. This is the maxilla. Can you see the articulation of the nasal bone and the maxillary bone? Okay. Superiorly, that is above, we have fronto-nasal suture. This suture, I told you about this suture. This is the fronto-nasal suture. Okay. And inferiorly, this inferior part of the nasal bone. Here you have the cartilage part, which we will see while studying about the skull when we will see the animation part. Okay. So we are seeing all the articulations of the nasal bone. Anterior side, which articulation? Internasal suture. Posteriorly, it articulates with the maxilla. Superiorly, there is articulation with frontal bone, and so the suture is known as frontonasal suture. And here, from in this part, what is filled here? Cartilage is present. Okay, cartilage bone is present. Okay, and here, and the anterior nasal spine. Can you see this spine part? This is the pointed tip part which is present here. This is known as anterior nasal spine. This is known as anterior nasal spine. What is it? It is sharp projection. It is sharp projection in the median plane. Which plane? Median plane. This here we have the median plane, and there is a sharp projection which is projecting towards outer side. Okay, median plane. In the lower boundary of, can you see the lower boundary? This is the lower boundary of this piriform aperture. Okay, and rhinion is the lowermost point of internasal suture. Can you see this structure? This is the anterior nasal spine, and this point, this is the lowermost point. This is known as a rhinion. Rhinion, which is lowermost point of internasal suture. So we studied about this aperture, anterior bony aperture of the nose, and we studied about different structures. First we studied the boundaries, that is the upper boundary and the lower boundary. Upper boundary is formed by the nasal bone and the lower boundary is formed by the notch of the maxilla. Okay, then we studied about the features. First is the articulation of the nasal bone. Here we have the articulation of the nasal bone, anteriorly internasal spine, sorry, internasal suture, posteriorly with the maxilla, and superiorly with the frontal bone, and inferiorly in this part you have here cartilage is filled. Okay, on the lower part you can see the notch, and that notch is little depression, small sharp depression is known as notch. Okay, but here you can also see the spine, the projection. Can you see this projection? This projection is known as anterior nasal spine. It is sharp projection in the medial plane, and the other structure which is the present at the lowest point of the internasal suture, this point is known as rhinion. Here we have anterior nasal spine. Am I clear? After studying all this part, that is two parts we studied, the frontal region and the orbital opening, and third part was the anterior bony aperture of the nose, and the fourth part of this Norma Frontalis is the lower part of the face. And in lower part of the face we will study about three bones, that is maxilla, zygomatic bone and mandible. Am I clear? Maxilla, zygomatic bone and the mandible. Now let me explain you about maxilla. So here we have the maxilla part. See, maxilla contributes a large part in the formation of facial skeleton. You can see the extent of the maxilla. Here you can see. These all are the parts of maxilla. I'm just outlining the left maxilla. Can you see? The large part is formed by, of the lower face is formed by the maxilla, and anterior surface of the body of maxilla presents. This is the nasal notch. This is the anterior portion. Anterior portion means the frontal portion, the portion which is most anterior. So here you can see the parts. This is the nasal notch. This is nasal notch of the maxilla. Nasal notch. Okay. Then we have anterior nasal spine. Although it is present at the border, we studied about this part in aperture, but this nasal spine is formed by which bone? This nasal spine, anterior nasal spine, is formed by the maxilla. Here you have anterior nasal spine. This is anterior nasal spine. Am I clear? And we have the infraorbital foramen on both the side of the maxilla. This is infraorbital foramen, which is 1 centimeter below this margin. Which margin? Infraorbital margin. This is known as infraorbital foramen. Okay, this is infraorbital foramen. Now we have the another structures. Here we have fossa. What does the word fossa means? See, fossa means slight depression, which is not deep but shallow, like this. This is notch. This is notch. But what is fossa? This is fossa. Am I clear? So can you see here this structure? Let me mark it with red. This is incisive fossa. Can you see this part? This is incisive fossa. And here you have the canine fossa. This is known as canine fossa. Here you have the incisive fossa. Okay. And here this structure is known as canine fossa. Let me mark it. This is known as incisive fossa. This is known as canine fossa. We will study about this structure and we will also know the significance of this structure. Canine fossa. Am I clear? So we have two fossa. That is incisive fossa, which is above the incisor teeth, which is present above the incisor teeth, and the canine fossa, it is present. See, this is canine and it is lateral to canine, and this part is known as this fossa. This slight hollow depression is known as canine fossa. So these were the structures which were present in the maxilla. We have some processes of maxilla, and we will study about those processes also. You can see this part, this extension of maxilla. Since this process, that is extension of maxilla, is towards the frontal bone, this process is known as frontal process. Am I clear? And we have one more process that is known as a zygomatic process of maxilla, which is short but stout. Okay, here we have the zygomatic process of maxilla. Can you see this, where it attaches to the zygomatic bone? This is the zygomatic process of maxilla. And here we have one more, this process, this part, this is known as the alveolar process of maxilla, where teeth are attached. So we have three processes of maxilla, extension of maxilla. This is frontal process of maxilla, this is zygomatic process which is present on both the sides, and this is alveolar process of maxilla. Okay, am I clear? This frontal process of maxilla articulates or joins anteriorly with the nasal bone, and posteriorly, this is known as the, and posterior, see here, anteriorly with the nasal bone and posteriorly with the lacrimal bone. This is the frontal process of the maxilla, which joins or articulates on anterior side by this nasal bone and posterior side by this lacrimal bone. Am I clear to you? So here we studied about the maxilla. We will also study about this maxilla part in much detail, but here we got some idea about this bone, maxilla bone, which is seen or forms the major part of the Norma Frontalis. Am I clear? Now we will study about the zygomatic bone. Here we see the structure, this bone. This is known as zygomatic bone. See, zygomatic bone forms the prominence of the cheek. When you touch your cheek on both the sides, you can see the prominent, you can feel the prominent part. That is known as zygomatic prominence, and there is a zygomaticofacial foramen is seen on this surface. We have the foramen which is known as zygomaticofacial foramen. In this diagram we are not able to locate that structure, but the foramen about which we will study in detail is present on this bone, and that is known as zygomaticofacial foramen. Okay, the lower part of the face is also formed by the bone known as the jawbone or the mandible. Can you see this part? This is the lower jaw. This is the lower jaw. So here in mandible we are seeing the structure, the upper border or the alveolar arch, which is, now let me show you which is upper border or alveolar arch. So this is the upper border or the alveolar arch of mandible, and this lodges the structure known as teeth. This is the teeth which is lodged by the alveolar process of mandible. Am I clear? And the lower border, this is the lower border. This is the lower border. Can you see this structure? This lower border is forms, or the lower border or base is rounded. When you look at this structure, you see the lower border or base is rounded. Can you see this structure here? See how rounded it is. This is the lower border or base of the skull, which is round, base of the mandible, which is rounded. Let me show you. This is the lower border or base, which is almost rounded. Can you see how rounded or smooth it is? Okay. So this is the structure of the mandible. Now we will see each and every part of the mandible, but not much in much detail. Just we get the proper idea. See, there is a middle point of the base, and it is called the mental point or known as gnathio. This portion, this is the middle point, and this is known as middle point, which is present at the base, and this is known as mental point. This is known as mental point. Am I clear? And the anterior surface of body of mandible presents some structures like symphysis menti. We have the symphysis. What does the word symphysis means? Symphysis means where the bones join. Actually, thing is that during the formation of mandible, it is considered, or it has been studied in embryology, that on both the side mandibles just develops like this and joins, and since the two bones are joined very closely, so this portion is known as symphysis. And here, since the two bones are joined very closely, that's why it is known as symphysis, and this is symphysis menti. Am I clear? And there is a mental protuberance. What is called this structure is known as mental protuberance. Here, can you see this structure? When you, even if you touch this structure here, you can see a little part which has been little elevated part or protuberance is seen. That is known as mental protuberance. Am I clear? Then we have mental foramen, which is present on both the side. Let me show you the mental foramen. See this structure here. We have the mental foramen. Can you see this structure here? This is the mental foramen, which is present on both the side of the mandible. Can you see this? This is the mental foramen. Am I clear? And mental foramen is below the two premolar, which transmits the mental nerve. Through these foramen, the mental nerve and vessels are transmitted. We'll study about them in detail later. Just we are getting an idea. Here we have external oblique line. Let me show you how this external oblique line looks like. See, oblique line runs upward and backward from mental tubercle. Here you have the mental tubercle, and it oblique line runs backward and upward. Can you see this? And joins ramus. This is the ramus part of the mandible. This is the ramus part of mandible. And this is the external oblique line, which is running backward and upward, and this is known as the oblique line or external oblique line, which runs from mental tubercle to the anterior border of the ramus. Can you see the anterior border of ramus? Am I clear? So here, till here we studied about all the structures which can be seen in the skull in case of Norma Frontalis. Am I clear? Now let's revise or sum up all the structure. Here we have this structure is known as the frontal bone. This is the zygomatic bone. See how the zygomatic bone is present, and here zygomatic bone, you can see the foramen is present here. Can you see the foramen which is present here? This is zygomaticofacial foramen. Am I clear? Here we have the bone known as maxilla. This is the left maxillary bone, and we can see clearly the infraorbital foramen. Different processes. This process, the frontal process, zygomatic process, and the alveolar process. And we have the lower part, that is mandible. So we studied about all the region, the frontal region, the orbital region, and the piriform aperture part. This is the piriform aperture. Can you see this is the anterior nasal spine. This is anterior nasal spine, which you can see here. Can you see this part? Yes, this is the anterior nasal spine. Okay, so we studied about all the bony structure. In the next lecture, we will study about the attachment, like attachment, that is attachment of the muscles, which we can see in a Norma Frontalis. Thank you so much.